Perfect. Thank you. And Hanna and I discussed before that we would like to make a quick introduction of the participants today so that we know from which country and from which field you are coming. So I do a quick handover to Hanna.
Yeah, you explained it perfectly, but I can start with presenting myself for those in the room who don't know me and also Evangelische Heimstiftung. We are a care company, a quite big one in the south of Germany. That means we have several nursing homes, where, of course, also palliative care is a big topic. And me personally, I am responsible for European exchange projects. That means I am not the expert in palliative care, but that is Anne-Christin, my colleague, who will also present later on. And then I maybe just hand over to our other colleague, Salomo, as well. Maybe you can also quickly say hello.
Hello. My name is Salomo. I'm a pastor and I'm in the Evangelische Heimstiftung, head of theology and ethics. And Anne-Christin is a colleague of mine.
Hello, Jitka Řeháčková, Diakonia Czech Republic. I work for quality management.
And then I think next to the Eurodiaconia staff members, it's only one person left. Yeah.
Hey, hello. I'm
Hi.
also from Diaconia, from Czech Republic, and I'm from Svitavy, from the unit, the smallest and the youngest unit of Diaconia in Czech Republic. And we are just in the process of building a new house for elderly. And so I am not absolutely a specialist in palliative care, but I'm keen on new information.
Well, nice to meet you.
Thanks.
Do you want us to introduce ourselves also?
I think it's fine. Like Louise, Donald, and Kiwan. Also nice to see you, but I think we know you, who
Okay.
you are. So
Great.
Anne-Christin, it's your turn. Stage is yours.
Yes, thank you. I'm Anne-Christin. I'm responsible for the palliative care conception in the Evangelische Heimstiftung, and I'm a nursing scientist. So this is my background, which you may be noticing in the in my presentation. Now I show you the presentation. Yes, I want to thank you for the opportunity to give an insight in our palliative care conception and also to discuss current developments in palliative care in Germany, focusing on the nursing homes. I want to give you an insight in our palliative care conception and also discuss actual developments in Germany, and will be interesting to see if there are similarities or differences in other countries. And also, if you are interested, at the end, we could explore some opportunities maybe for further contact on this topic. So here you can see the outline of my presentation. First, I would like to describe the overall structural foundations of palliative care in German nursing homes. To this end, it's important to briefly discuss also the basic organization of palliative care in Germany overall. And then I would like to introduce you to the Evangelische Heimstiftung quickly as an organization, which Hanna already did a little bit. And then we'll focus on our palliative care conception. And at the end, I will point out some current national developments in Germany and which challenges this may bring to providing palliative care, and this may be a foundation for our further discussion. So First, let's start with the structural foundations of palliative care in Germany and in German nursing homes. So the organization of palliative care in Germany is characterized overall by a strong voluntary movement. It's called the hospice movement, and on the other hand, professional structures for providing palliative care. On the right hand, you see that in Germany there exists some outpatient hospice services where voluntaries get a special education, and they then can provide on a voluntary basis some emotional support for people at the end of their lives and their families. And they also have the aim to strengthen to removing the taboo surrounding dying and death in the society. And on the other hand, there are a lot of professional services in Germany that all are providing palliative care. It's divided in two sectors. On the one hand, it's called allgemeine Palliativversorgung, which you can translate like there are some generalists in palliative care. That means that all healthcare services in Germany needs to provide palliative care for people at the end of their lives on a general level. This addresses general practitioners, also like every wards in hospitals, and also the outpatient care services mostly provided by nurses, and not at last the nursing homes are also a place that provide general palliative care for the people in mostly old age. And in addition, there are also specialists who provide palliative care in Germany. These are, for example, special units or services in hospitals and also hospices. And there is it's called SAPV teams. These are specialized teams. These are interprofessional teams, doctors, nurses, social workers, who provide specialized palliative care for people that suffering from quite complex symptoms. And so they are organized a little bit different. Often they are added to a hospital, but they visit people everywhere, at home, in nursing homes, wherever people are suffering at the end of their lives. So these, as a quick overview of the healthcare, palliative care, how it is organized in the healthcare system in Germany, and to have a deeper look how this is shown in our nursing homes. The general palliative care is an integral part of our regular care in German nursing homes. And these specialized teams also can come to our nursing homes when the symptoms are too complex to deal with in the general palliative care. And nursing homes are also must cooperate with these voluntary-based outpatient hospice services according to the latest law in Germany. And this making a good cooperation with these voluntary services is also a part of an external quality control of German nursing homes. So palliative care in German nursing homes has a long tradition. It always has been a big part of the care we provide in nursing homes. The first concepts emerged in the 2000s, and at that time there was a strong focus on providing a good farewell culture and to establish rituals and memorial services And since 2008, there is a need for every German nursing home to provide palliative care based on a concept according to the social law. And in 2015, there was a big act that strengthened the palliative care services for overall in Germany, but especially also for the nursing homes. It's called the Hospiz- und Palliativgesetz. This strengthened the financing of palliative care in Germany, and it also ensured that advanced care planning, ACP, which is maybe also a concept you know in other countries, that this is financed for the nursing homes. And also this law strengthened the cooperation between the professional services in the nursing homes and the voluntary services in the outpatient hospice services. And maybe not directly depending to palliative care, but it influenced a lot of debates ongoing till now in Germany. There was a court ruling in 2020 which changed the regulation about medical assisted dying in Germany. So this provides a discussion about the need of or the role of suicide prevention that palliative care could bring. So besides the long tradition of the importance of palliative care in the nursing homes, we can notice also an increasing ongoing importance of palliative care in nursing homes. So recent studies show that the length of the stay of residents in our nursing homes is becoming increasingly shorter. A new study shows that the residents in our nursing homes are living about 12 to 24 months in our nursing homes. And this also causes that the residents are more and more of advanced age and in need of complex care, which makes an early integration of palliative care more and more important. Some concepts say that we need to provide palliative care from the moment the residents move in to our nursing homes. And also another fact that may underline the importance of palliative care in the nursing homes is that the specialized palliative care service are not that available that they should be that they could be. So for a quick insight, we have in 2020 we had 64 hospice beds per 1 million people in Germany, and the actual recommendation from the European Association of Palliative Care is between 80 and 100. So there is a lack of hospice beds. And the number of these specialized palliative care teams, which I introduced, the number is overall increasing in Germany, but still, especially in the rural areas, there is limited accessibility to these specialized teams. And also, we see in Germany that there is still a low awareness that palliative care is a concept that is not only for people suffering from cancer or oncological diseases. So especially with a look on the nursing homes, it's also a concept that is important for people with incurable internal or neurological diseases. So this lack of awareness still hinders sometimes a proper support. But as you can see so far, palliative care has a long tradition in the nursing home, but the importance is still increasing. And so there are some national concepts and guidelines who help nursing homes to implement palliative care. And you see in the middle that there is a national strategy for providing palliative care in Germany, and this it's based on a Charta for the rights of people who are at the end of their lives. And this also includes the importance of the nursing homes. And on the right, you see that the Federal Ministry of the part of Germany where we live also published a guidance how we can implement palliative care, which is also the basis on which we developed our palliative care concept. So after this overview over Germany, I will come to the Evangelische Heimstiftung as an organization and then go deeper in our palliative care conception. So Evangelische Heimstiftung was founded in 1942 after World War II, and here you see our founder, Antonie Kraut. We are a diaconical non-profit care company. And here you can see our figures at a glance. So you can see that the nursing homes are a big part of our care that we provide. We provide at the moment care for 6,900 people in 92 nursing homes. And we provide also home care services, daycare services, and other services, mostly for people that are in high age. And our nursing homes are located in a part of Germany which is called Baden-Württemberg, and here we are the largest care provider. And just for a quick insight, I show you 4 pictures of our nursing home that you see, maybe have an impression where we provide the care. So now I will come to show you an overview and a little deeper insight in our palliative care conception. So our palliative care concept is based on a shared fundamental attitude, which also refers, of course, to common palliative care definitions. And maybe as a little introducing, we choose this symbol, the rainbow umbrella, to point out that the living in nursing homes often is characterized by the simultaneously of grief and joy and of life and death that often comes so close together while living in a nursing home. And also the umbrella is a symbol for us for the protection and care we want to give the people at the end of their lives. And another point that we are aware of is that if the implementation of palliative care is based on 2 approaches, on 2 key approaches. On the one hand, we need to address the organizational culture overall, because implementing palliative care is a change process for the whole nursing home, its structures and processes. And on the other hand, we need to develop the competences of the nurses and of the whole team that provides palliative care. So what we did was that we developed 2 guidelines. One guideline leads the management of the nursing home to implement palliative care, and another guideline based on the guidelines I showed you before guides palliative care teams, which we established in every nursing home to support this implementation and to continuously support the whole team by providing palliative care. And here you can see an overview that we developed a lot of processes and standards which we could discuss all in more detail, but I just want to give you an overview. So one aspect of our palliative care concept is shaping collaboration and cooperation, especially with these specialized teams and the voluntary services. And of course, the biggest part is to prevent and reduce suffering with a special focus on quality of life. We shape a culture of farewell, and also in this aspect, we try to deal good with grief and death wishes. A big part is to involve and support relatives, to explain them frequent changes and symptoms that come at the end of the lives, and also we try to creating relief and self-care also for the carers. And another part of our concept is also advanced care planning, which is called gesundheitliche Versorgungsplanung in Germany. This is an opportunity to plan ahead what the person wants for the care at the end of their lives. And this is a quick overview of all the more detailed processes and standards we have, and here some insight in the effort we put to establish continuously the competence in palliative care. So palliative care is a little part of the for new managers, and at least we ensure that at least 2 specially trained nurses work in each nursing home, and the qualification is certified by the German Society of Palliative Medicine. And we are aware that all the staff working in a nursing home needs to know about the fundamentals of palliative care. So they are also qualified, and we heard this also from Austria in another presentation, that there is a special curriculum for people working in a nursing home. And in our internal training program, we constantly address some deeper aspects of palliative care. For example, now we provide a day for the question how to guide nursing students in dealing with death and dying. So in addition to this overall, or to this quick overview of our conception, I'd like to address, or I'd like to give you some deeper insight to a special challenge we see in our nursing homes, that it's challenging to avoid hospital stays at the end of life. And which is not in every time wrong, so it could give some, there are situations where it is needed to put a resident in the hospital, but with a closer end of life, it's more and more not a good quality of care if we got a hospital stay. So this is not so easy because residents in German nursing homes receive medical care through the regular general practitioner services. So there's no doctor available in the nursing home. And this makes it difficult to respond promptly and suddenly worsening systems, especially on the weekend and in the night. And so there's often the only chance to call an emergency doctor, but they usually are not so good trained in palliative care, and they mostly have a clear aim of preserving life, so they often make an hospital stay. So when it comes to symptoms, exacerbations, they can lead to hospital stays at the end of life. So this is a common challenge in German nursing homes, and now I will show you how we try to deal with this challenge. We think at the moment that a good solution that we have in these structures is that we make a good foresight planning. And so we try to assess, so we try to identify quite early when a person is in need of palliative care. And for this, we use a special screening instrument. It's called ID-PAL. It's an instrument from Switzerland, which has a good specificity, good outcomes. So we can recognize quite early and quite on point when a person is the need of palliative care is incoming. So when we assess this need of palliative care, we make a chart review and discuss this with the general practitioner, so we plan ahead for potential crises that may come, that we don't have to call the emergency doctor. And this also goes ahead with the offer of advanced care planning, which is always free for our residents. They can use it if they want. And our advanced care planning concept also focuses on planning ahead for emergency situations. So these are the main key aspects by which we try to avoid unwanted hospital admissions at the end of life. So these you have on the one hand an overview of our palliative care conception and also a little deeper insight in our how we deal with this challenge to avoid hospital stays at the end of life. And now I want to point out some current national developments in Germany and the challenges they may bring for providing palliative care. So I want to talk a little bit about the situation of advanced care planning in Germany. Advanced care planning is financed by health insurance in Germany since 2018, but only for people who live in nursing homes. And when you have a look how advanced care planning is organized in other countries, it is often available for all people living in a country and maybe also available for all people, for example, provided by the general practitioners. So it was a quite special decision from the Federal of Germany that they finance advanced care planning also only in nursing homes. And in our experience, we provide advanced care planning now since 5 years. mostly. And it's a quite important concept for our nursing homes, especially to plan ahead for crisis and emergencies. And however, we see that we reach people quite late in their lives when they come to nursing homes. And many of the residents are at this point only limited in the able to tell us what they want, because many people who live in nursing homes suffer from dementia, for example. Yeah, so we think it will be a task for the future in Germany to extend the access to advanced care planning in other settings than the nursing homes. So this may be an interesting topic to discuss and to hear from you how the situation is in other countries, how we heard it from Austria in one of the other sessions, that there the general practitioners provide advanced care planning. So in Germany, an evaluation of this law for advanced care planning is planned, but we don't know when this will come. And another actual development in Germany, which may also be interesting for the further development of palliative care with focus on nursing homes, is a new draft which is planned in Germany. It has a complex name, which we can translate in English like an act on the expansion of powers of nurses and reduction of bureaucracy in nursing care. So it's a law planned in Germany that will enable nurses to act more independent, for example, in the areas of diabetes, wound management, and also in the care for dementia. So this it's planned that nurses will be authorized to issue their own prescription within certain limits. And there it is planned that a model scope of practice is to be created to specify which medical services nursing professionals are permitted to perform. So I think this is an interesting development which may offer the opportunity that to create a new role of nurses in the nursing homes relating to palliative care, maybe according to the advanced practice nurses profiles in other countries. So this may be also an interesting point to discuss on which qualification level the nurses in your nursing homes work, which maybe also be a point where we can improve to avoid the hospitalizations at the end of life. Yeah. Yes. So thank you very much for your attention. You can see the references if you're interested in the presentation later on. And now I'm looking forward to some discussion with you.
Thank you so much, Anna-Christina, for that presentation. Is really detailed, and I could already start seeing some similarities with what we've heard from other countries. And I think it's a shame we don't have so many members, but I hope that if you have any questions, please do not be shy. We have few, so please do feel free to unmute yourself and ask the question, or you can type it in the chat, and Donald is going to help us to read the question out. So thanks again, Anna-Christina. As you're presenting, I had one question myself, but I think you did answer it already. guess my question was the financing. And if I heard you correctly, you said it's being covered by the insurance, and the person's need of is linked to the insurance. And for the people living in residential homes, right? Is that correct?
Yes, we have to differ the financing of palliative care and the financing for advanced care planning. Advanced care planning is there is a special financing in the nursing homes, but the financing for palliative care, it's in German nursing homes, it's an overall financing. So the regular care is we have to do palliative care within our regular care financing in the nursing homes. So yes, this could be better because especially at the end of the life, the financing is based on the need of care overall, but there's no special assessment for the need of care at the end of life. And this is often characterized by a quick change of the symptoms. And so, yes, there's often the only opportunity we have is to call these special teams, and this special service is also financed by the health insurance.
Thank you. Does anyone else have a question? Often it's a good sign when you don't have a question. That means everything was well presented. So thanks again. The last time we heard from the Nordics, or the last time we visited some members, they complained about with the process of DI, deinstitutionalization, that people tend to live longer in their homes, and they only get into residential care when they're almost at end of life and they have end of life needs. Is that the similar situation in Germany, or is different?
No, it's quite similar in Germany. There is the most care is provided by relatives in Germany, and the people, it's a great wish of the most peoples in Germany that they can, when they choose where to die, they would like to die in their own homes. And so there are lots of, everyone is trying to make this possible. So this, leads to that they come even later in our nursing homes, and so are in need of complex care. Yeah.
Interesting.
I myself have a question. Because of course it's also a new topic for me. Anne-Christin, you mentioned that that is linked to Kiwan's question. Almost all new residents in our nursing homes need palliative care because they are so advanced in their care needs and in their age, right? Did I understand it correctly?
There are lots of concepts who describe palliative care for nursing homes, and they yes, they say we should provide from the moving in, but I think it's important to make a bit of difference. So often the moving in a nursing home, on the one hand, is related to grief and lots of losses, the loss of the home, and also the awareness that this may be the last weeks and the last stage of the life. But on the other hand, we cannot say that everyone moving in a nursing home is in need for palliative care. So we thought it's important to do this special assessment to have a different or a good look on who is in need and who not. Yeah.
Thanks.
Thank you. I hope with the evaluation of the advanced care plan, you said the evaluation is ongoing or is planned. I hope that it will extend to people who are not in residences, to explain to the wider community to make it better. Yeah, so thank you again. And if there is no other question, I think it was a last 40 minutes well spent. Thank you. And we'll see with other members what we can do for next year. So I'll be in touch. We'll have a meeting. We'll send out an invitation for a meeting for this palliative care working group and decide together how we can proceed next year, what we want to do with this topic, because there's still a lot of interest and so many members are working on it. So agree what we can do going forward. So thanks again, and do have a lovely afternoon, rest of the afternoon. Thank you. Bye.
Thank you. Bye.
Thank you, everyone. Take care.
Thank you.